So now let's have applications of gynecology, that is application of ultrasounds in the gynecology. So before getting into that, we will see what is the gynecology. So gynecology is the branch of medicine which is mainly responsible to take care the health of reproductive female reproductive system. Okay, so it covers the wide areas which includes the menstrual disorders, even it covers the pregnancy or fertility state, sexually transmitted infections and menopause. So these are the wide range we can cover in gynecology area. So the gynecologist can also perform some kind of examinations, screening and surgeries related to the women reproductive health. So this field it's more often overlap with obstetrics, which is they are very specific. Okay, they are very specific to the pregnancy and childbirth. So gynecology is the vast area. So in this area we are very specific. We have to be very focused, means that is the obstetrics. Okay, is a vast area. The obstetrics is the part of that which is mainly focusing on pregnancy and childbirth. Okay, so now we will see the application of ultrasound in gynecology. So the first is since it is being covered with all the things whatever we discussed in earlier, so we will start with pregnancy. So pregnancy monitoring at early stage. Okay, so we can have a estimation of first we will confirm the pregnancy, and followed by we will have a calculation of a gestational stage, and you can have a check the multiple pregnancy, like whether the person have twins or triplets and etc. And we have fetal development. Okay, so regular ultrasound scan we have to be performed to check the fetal development at each and every stage, gestational stage, to have to have the fetus in normal development. Okay, and also it is easy to identify any abnormalities at the early stage. And gender determination. So ultrasound is often used to determine the baby gender, whether to find male or female, which is usually done at weeks of 18 to 20 weeks of gestational age. And Doppler ultrasound which use the measure the blood flow in the umbilical cord, placenta, and fetal organs to ensure the fetus have receiving the 100 percentage of oxygen and nutrients. If we have problem with this, then we can easily identify and we can go with any other alternative options. That is the first case. And second case is fertility assessment treatment of ovarian monitoring. So fertility assessment is the now it's serious issues the most of the females are going through these days. So that type of assessment we can do by this of ultrasound. Okay, so here we will be tracking the development of follicles in the ovaries during fertility treatment, such as in vitro fertilizations, and you have uterine evaluation. Here it will help to detect uterine abnormalities like any kind of fibroids or polyps or congenital anomalies. It may be if there is any these kind of abnormalities present in uterine, or if it is present, then it will affect the fertility and which may leads to the miscarriages. So the ultrasound here, it is being very big role to identify the evaluation of uterine, to have or to diagnose any kind of abnormalities it's present or not. And fallopian tube assessment is very important. So this fallopian tube assessment again we can do with ultrasound here, which help to visualize the issues in the fallopian tubes through some kind of invasive procedures like hysterosalpinography, HSG, and or this is a particular procedure, invasive procedure. With help of this, we will examine what is the fallopian tube status. Okay, so here also we need for navigation we need a support or a help of ultrasound. So next one is the gynecological disorders, that is overall gynecological disorders, and diagnosis if you have any fibroids or polyps. The ultrasound can detect the presence of size and location of uterine fibroids. The fibroids is nothing but is a non-cancerous tumors. You might ask question, what is the difference between cancers and non-cancerous? It's very simple. The cancerous is one spreading, okay, that we can say malignant tumors, or non-cancerous is the early stage, that is a benign tumors. It doesn't doesn't have tendency to spread or affect the other organs. So that is the reason we are saying that that is a non-cancerous. So fibroid is nothing but is a non-cancerous tuberance. This ultrasound which helps to detect the presence of that fibroids or even the size and location of these fibroids. Okay, and ovarian cyst, the cyst is it's like maybe fluid cyst or a solid cyst. So it will again this ultrasound helps to detect the ovarian cysts and their size and whether they are solid or filled with fluid, which is very important for determining the treatment, because later on it will be get turned into fibroids at higher chance. Okay, so this is the reason we have to taken into immediate action at the early stage. And endometriosis is the like one serious problem, that is just related to endometriosis. Endometriosis is the layer you can know which is there in the uterus. So if you see any problems or any cyst in that layer, then it is called endometriosis. It also very important to see this particular layer or problems before the going for fertility test. And next one is the pelvic inflammatory disease. The ultrasound will also give the information or any fluid accumulations or any pus accumulation is there in the pelvic region. That particular problem is called pelvic inflammatory disease. That also we have to treat immediately.